Our next speaker is Sarah Knox. Sarah completed her PhD in biomedical engineering at the University of New South Wales in Sydney, Australia. She completed a postdoctoral fellowship at the University of Minnesota and a visiting fellowship at the NIH before joining UCSF as faculty in 2012. Her lab is focused on understanding the relationships between multiple cell types within organ systems to regenerate or generate these tissues in the advent of organ failure. The title of her talk today is, "And You Think the California Drought is Bad."
Great. Thank you so much for having me today. It's my pleasure to be here. I can see my Dean of School of Dentistry. Shout out to all those dentists out there in the crowd. I come from a drought-ridden country, so do you think that I know a little bit about drought? Yes. And I study dryness as well. How about that for crazy? So I want you to think about saliva. I know you know about saliva because when you were in 3rd grade, you used this a lot. You projected small pieces of paper through a straw using this biological fluid. You threw it out of your mouth to compete with friends. You dangled it from your lips. And then, unfortunately, your parents stepped in and said, "This is really inappropriate behavior. You're going to have to repress this." And so you did because you're good children. You were good children, and of course you were good. You came to UCSF, right? So you must have been good, but you forgot about it. And I want you to remember it now. I want you to become more passionate about it. It's sitting there right now. It's doing the things in your mouth that you just take for granted. So let's stop taking it for granted. So I'm going to walk you through what it's like to have a dry mouth. So you know what it's like to have a dry mouth. You've had one before. But imagine there's never enough water. Never enough water for you. There is actually no cure for dry mouth disease. So whenever you think about dry mouth, you'll have a sip of water, but it comes back immediately. And that's what it's like. And so what happens is you become really tired. You're not getting much sleep anymore. And the reason is because every 20, 30 minutes you have to wake up and rehydrate, right? So your partner is really unhappy with this event. So your interpersonal relationships are slowly coming under a lot of pressure. Now, that's not just that, that's just the start. And unfortunately, your partner's also going to be discovering this. These teeth no longer are the ones that they got involved with in the first place. And so here, these are beautiful teeth. This is a dentist's nightmare. But as you can see, all this saliva up here, it's too gorgeous. You're never going to get any money out of this mouth. But down here, we've got tooth decay, massive tooth decay. And what's happening here in this patient is they don't have any saliva. No saliva. And saliva is a solvent for calcium and phosphate. And that's remineralizing your teeth as we sit here. So without that, you're going to get tooth decay. Some awful other things are going to be happening to you as well. And this is also going to be bad for your personal relations. And it's called oral infections. So bacteria, viruses, fungi can start inhabiting this mouth because saliva has antibacterial, antifungal, and antiviral properties. Okay, so you have this mouth and you think, well, I'm just going to take it out to dinner and have a good time. Well, the problem with this is now you can't eat what you used to. You can't eat hot food. You can't eat sharp food, all that crusty, rustic bread. You're not going to have that anymore. You're going to have to stick with warm, soft food. And it's not going to be, a delightful thing. You won't be able to taste food either. But the main thing I'm talking about here is that saliva is important for wound healing. So you may, when you cut your tongue, you notice that a couple of hours later you no longer feel that cut. And that's because saliva is promoting that wound healing. We're actually studying that currently. Okay, so you've got this mouth and you think, oh, I'll just drink my sorrows away. Well, unfortunately, that wine doesn't taste very good because obviously you've got no taste perception now, you've got no saliva, but also you've got this burning sensation in your mouth. Okay, so I hope you've all got a good grip on what dry mouth syndrome is like. And what can we do for these patients? That we can do nothing, but who are these people? Who are these unfortunate people? And they happen to be the people that you do not want to feel these things over their lifetime. They're cancer survivors, and they're people who suffer autoimmune dysfunction. autoimmune dysfunction, such as people who suffer Sjogren's syndrome. This is 2 million people. And unfortunately, ladies, 9 out of 10 of those people are going to be women. So this is very disruptive for many people. Now, head and neck cancer. Head and neck cancer, 40 to 50,000 people per year have head and neck cancer. We stopped smoking, but we're still getting it, and it's on the rise. Now, most of these people will undergo chemotherapy. In fact, 100% of them will do that, and they'll get radiation therapy. And this is fantastic for killing tumor cells. This is why we've been using it for the past 40 or 50 years. It's killing the cancer, but it's also, unfortunately, killing your salivary glands, the power plant of saliva. Right? Because you cannot get salivary glands, put them out of the way. They are heavily affected. And so what you happen to have are these. So you've got these images, we've got these images here for you to look at. This is a really healthy looking gland, bulbous acinar cells. These are these green cells here. The green is actually amylase. You've heard about this before. It's digesting your breakfast as we speak. And down here in this patient who's undergone radiation therapy, you notice these acinar cells are not looking very good at all. They are disrupted. This patient's lucky they've got some. But typically, we don't see acinar cells anymore, right? They are destroyed by radiation. And we've known this for some time. But in my lab, what we've discovered is that the nerves are just as important for, obviously for function, we've known that, but for regeneration. And let's talk a little bit about that. So in these patients, so here's a healthy person up here. These are parasympathetic nerves. So when you see that piece of chocolate cake, right, your CNS goes, I want that in here. So you start, your parasympathetic goes, okay, I will do that for you. You have no control over that parasympathetic, which could lead to a lot of drooling, unfortunately. And so because you've got all this drooling, you can push that cake in as much as possible, and it's fine. Well, this patient obviously does not secrete saliva, and it's due to the acinar cell lossage, but it's also due to this decrease in nerve supply, right? And so I'm sure you know that. This is obvious. Nerves are important for secretion, but what you are not aware of is that nerves not only important for this function, but they also play a very significant role in tissue maintenance and the continuous repair of your tissue over its lifetime, right? So what we study is how these nerves control regeneration. And how do we know they're involved with regeneration? Well, we and others have shown that if you denervate, if you remove these nerves, the tissue atrophies. And I should tell you that this is actually used currently as a tool for drooling, right? As a cure for drooling, right? These patients have some very small, tiny salivary glands that don't secrete anymore. If we re-innervate that tissue, the tissue regenerates. So this might suggest to you, as it suggests to us, that the nerves are making factors that are controlling regeneration, that are promoting regeneration. So can we then hunt down these factors, these neuronal factors, using non-violent methods to identify neuronally produced factors that are going to promote regeneration? And so we are doing this through mouse genetics, through studying human tissue, finding what these neuronal factors are. Some of them are acetylcholine related. Some of them are other peptides and growth factors. And then we're also got to find out, well, what cells are they targeting? And how are they targeting those cells? So we're hunting, again, non-violent, using many genetic methods to find these stem cells, and we've got some ideas of what they are. So the goal is to find and identify molecules that we can use to regenerate patients' salivary glands or create them de novo. And the idea is to return these people, these unfortunate people, to a quality of life that they deserve. Thank you.